Hi, this is Madisen Fors, and this is practical for heart rate and blood pressure. The first one we're going to do is heart rate. So for heart rate, you're wanting patient to stay nice and relaxed. You're now going to palpate the radial artery, so the radial pulse, by being on the thumb side and doing just proximal to the wrist. You want to make sure that you use a finger that is not the thumb, because the thumb has its own palpable pulse. Therefore, if you use it, you're going to grab your own pulse rather than the patient's pulse. So once you're able to get a nice steady beat, you want to press go, and you want to have a timer for 30 seconds, and then you're going to times it by 2 to get the beats per minute. Okay, ready? So press. Okay, press it. Okay, so for time's sake, we decided to do 15 seconds. This isn't as accurate, however, it can't be used right now. So with that, he had 14 beats per minute. From there, we are just gonna times it by 52. 4, which is 52. So this puts him on the lower range. He should be between 60 to 80 beats per minute at rest, so a little bit lower, but also more athletic populations, they're going to have just naturally a lower resting heart rate. The next thing we're going to do is we're going to do blood pressure. So you're going to want the patient to just be nice and relaxed with their arm kind of supinated and slightly extended. You don't want them to be fully extended because you want them to be nice and relaxed and in a comfortable position. So what you're going to do is you're going to find the brachial artery, which is more on the medial side. And you're going to put your blood pressure cuff where it says artery mark, and you're going to put it right around there, kind of in the middle of the bicep, and you're going to wrap it around. You're going to have your patient still stay nice and relaxed. You're going to put the little thing in, and then you're going to grab your stethoscope, and you're going to make sure that the things are pointing into your ear. The next thing we're going to do is you're going to put your stethoscope, and you're going to put it kind of in the medial part, right where that brachial artery is. You want to make sure that you don't use your thumb for this, because your thumb has its own palpable pulse. The next thing we're going to do is we're going to make sure this is fully empty and closed, and then you're going to pump it up to about 160 to 180. I like to do 180 because it allows me to have more time to find the proper release that I like to do. And so from there, you're going to slowly start to release it, and you're going to do it about 2 to 3 millimeters at a time. So once you heard the first cross-off sign, so the first thump, that is going to be your systolic pressure, which is during the contraction. And then your last crossed-off sound is going to be your diastolic pressure. So for a normal resting heart rate, this should be between, your systolic should be about 120 or a little less than 120, and your diastolic should be less than 80. So this is how you do pressure, blood pressure, and pulse rate. Thank you very much.